Understanding asthma. Asthma is not a disease as such, but a group of signs and symptoms that have been given the name asthma. This was the basis of an article in The Lancet in 2006 entitled "A Plea to Abandon Asthma as a Disease Concept." Over the last decade, hundreds of thousands of people diagnosed with asthma have taken control of their condition, reduced or eliminated their medication safely with support of their doctors, and returned to living a normal wheeze-free life. Is this a cure? Perhaps not, but being without the debilitating symptoms and using less medication is good news for everyone but the drug companies. Symptoms associated with this condition we call asthma are due to overbreathing or chronic hidden hyperventilation. This was the radical concept developed by Professor Konstantin Viewpoint after a lifetime of research into the effects of breathing on health. Reduction of chronic hidden hyperventilation leads to a corresponding reduction of symptoms of asthma. This has been proved in a number of clinical trials over the world. Modern medicine, not understanding the cause of the condition, is left with the only option, and that is to treat the symptoms, leaving the underlying cause untouched. Treatment with bronchodilators, typically Ventolin or equivalent drugs, does open the constricted airways and relieve the symptoms. However, this group of drugs are adrenaline-based and increase the breathing rate, so making the condition worse. The first vicious circle, which led to a serious increase in asthma deaths in the early years of modern medical treatment. An international forum of respiratory experts then recommended the addition of a preventer medication to control and manage symptoms. These were corticosteroids that reduced inflammation and even reduced breathing rate. But repeated use of steroids may suppress the immune system and lead to more infections and colds, a common trigger for overbreathing and asthma. This created the second vicious circle, which together with the first means the treatment of asthma makes the condition progressively worse. Most asthma sufferers find they need more and more medication to manage their condition as the years go by. Often this may go unnoticed as medications are changed for increasingly more powerful ones. Asthma is not new. It is recorded in ancient history as the sharp breath disease. The interesting fact is that very few people used to die of asthma. In fact, very often they seem to avoid many other diseases, living to a good age. They may have occasionally been unable to work or do much during periods of peak symptoms, but would recover easily afterwards. Deaths from asthma are now significant even amongst the young. This may be due to the exacerbation of symptoms from the medication given, either inappropriately or not used by the patient as directed by the doctor. There may be strong genetic components to asthma sufferers, but such individuals have to habitually overbreathe or hyperventilate to develop symptoms. Others who have chronic hidden hyperventilation may be predisposed to other diseases such as hypertension, panic attacks, hay fever, and 100 or so other modern diseases associated with hyperventilation. It is often argued that environmental triggers lead to asthma attacks, but what most of these triggers do is to stimulate overbreathing, inflammatory reactions of airways, and production of excess mucus that leads to the signs and symptoms described as asthma. It was once thought that polluted atmosphere were the major cause of asthma, but the highest incidence of asthma is not in major industrialized areas, but in New Zealand. One logical explanation is that New Zealand has an excellent health service that responds instantly to the earliest signs of wheezing in children and adults with asthma medication. The well-known violent reaction of asthma sufferers to allergens or irritants is due to the high level of histamine produced by their bodies, and that this overreaction may be due to an over-sterile childhood environment that failed to stimulate normal development of their immune system. Often vigorous exercise, stress or emotional upsets may lead to an asthma attack due to the increased breathing these triggers cause. If you or your child suffer from symptoms characteristic of asthma, ask your doctor to check your breathing rate and character to ensure you are not simply suffering from the protean consequences of hidden chronic hyperventilation. Alternatively, you may check your own breathing by watching the next video in this series. How do I know I'm hyperventilating? Thank you.